Lung Foundation Australia have produced a series of 10 short video clips addressing some of the most commonly asked questions and symptoms that trouble people with chronic lung disease. The term chronic lung disease covers a large number of different diagnoses. There's a whole lot of different diseases that can cause persisting or chronic symptoms for patients. The most common of these include chronic obstructive pulmonary disease secondary to smoking, things like emphysema and chronic bronchitis, but also include interstitial lung diseases, bronchiectasis and lung cancer. The symptoms of chronic lung disease, being breathless all the time, having a cough, make it really difficult to do the normal things that the rest of us take for granted. This series of 10 videos is called Better Living with Your Chronic Lung Disease. We really hope that by watching these videos, you'll be able to gain some skills to maintain your own lung health, possibly to manage your own symptoms better, and to engage with your health professionals, with your doctors and with your nurses in order to feel a greater sense of control over your symptoms.
This segment, called Managing Your Lung Disease, will provide you with a better understanding of the importance of self-management. You will learn the skills you need to actively participate in your healthcare through working in partnership with your healthcare team and better managing your lung disease.
A person should self-manage to gain knowledge and skills about their condition so they can manage it on good days and bad days. You will have better discussions with your health professionals and they will assist you with managing your disease, and that will reduce anxiety and also provide you with information on how to manage.
The thing that helped me most when discussing treatment options with my doctor was being able to talk to him and know that I was going to be listened to. A good relationship with your doctor is important and helpful, especially when it has to do with symptoms that you've not experienced before, medication that you've not been used to taking.
Understanding your lungs and how they work will help you better understand your disease and better understand what your doctors are talking about. A great way to learn about this is to watch the segment called How Do Your Lungs Work? It will give you a visual display of your respiratory or breathing system and how it functions. Having an understanding on exactly what is happening to your body will better help you make informed decisions about your healthcare. Lung diseases have very different symptoms, but for the purpose of better living with your chronic lung disease, we will predominantly focus on breathlessness and fatigue.
Breathlessness is the feeling of being short of breath, which is sometimes referred to by your doctors as dyspnea. Breathlessness can affect a patient's life in a variety of ways. Some people get breathless during certain activities, or for some people they experience breathlessness at rest. Breathlessness does not necessarily mean that you require oxygen therapy. Sometimes it can just require rest and to pace your activities. For more information about this, refer to the section on managing your breathlessness. Fatigue can be described as a loss of energy, sometimes related to a reduction in stamina or endurance, increased confusion, and general tiredness that may not be overcome by rest or sleep. Fatigue can impact a patient's life in lots of different ways. It can reduce your ability to complete your activities of daily living and your social activities, and may require you to plan what you do and pace your activities. For more information on this, refer to the section on managing your fatigue and energy conservation.
Practicing effective self-management is not just knowing what symptoms to look out for, but also knowing about your prescribed medications, what these medications do, and what treatment options you have.
The treatment of lung disease varies depending on both the condition that you have and its severity. Some lung diseases require you to take medications either through puffers or inhalations or tablets. Some people require machines for oxygen therapy and sleeping machines known as CPAP or BiPAP machines. And other different lung conditions may require chemotherapy, radiation therapy or surgery.
The segment Managing Your Treatment Options will assist you in understanding the importance of knowing about your medications and treatments. This will assist you to manage your condition, symptoms, and side effects as effectively as possible. The segment Who is Your Healthcare Team will provide invaluable information on who will be in your healthcare team and how to make the most of working with each of them. Questions I Can Ask My Health Professional explores the different types of questions you can ask of them to ensure you have all the information you need to become more effective self-managers. Having a lung disease can affect other parts of your well-being, including your physical, social, and emotional well-being. It is important to manage all aspects of your health to ensure you have the best quality of life, and so you can be more in control of your health.
It's important for patients to look after their physical, social and emotional health. To maintain your physical health, you need to maintain a healthy, well-balanced diet, physical activity and taking your medications as prescribed and keeping your vaccinations up to date. If your lung disease is affected by allergies or pollutants, if able, try and avoid the things that you know make your breathing worse. To maintain your social health, it's important to prioritise your hobbies and the things that you enjoy doing and maintain an active social life with friends and family. If you find some of these activities are becoming too difficult because of your breathlessness, you may need to plan the activities or alter them so it's easier for you to manage and less fatiguing. Panic attacks, anxiety and depression are really common for people with a breathing condition. So to manage your emotional health, it's important to, again, take time for relaxation, prioritise your hobbies, and if it's really affecting your life and what you want to do, talk to a professional about managing these conditions. Tips for looking after yourself and your lung disease should provide you with some ideas for maintaining a wide, varied life and keeping up with the things that you'd like to do.
The segment Benefits of Exercise Programs and Ongoing Support will highlight how key programs such as pulmonary rehabilitation and patient support groups can benefit people such as you and your caregivers.
Self-management follows through all stages of care with chronic lung disease, particularly in the last stages of life. It's more than just looking after your symptoms. Self-management also implies all the other things other than symptom management. It's really important that in consultation with the people who care for you, your doctors and your nurses, and in fact your family, that you have a plan for what's going to happen to you as your disease progresses. This includes things like having a will in place and having self-management plans for what might happen to you when your symptoms do progress.
After accessing supportive and palliative care services, I feel a lot better about myself. I have more confidence, and I find that together with my exercise groups has given me a new lease on life. I feel like I've got back into the social things I used to do before. I'd given up on a lot of things before, and now I feel that I'm on the right path again.
The segment Supportive Care and End-of-Life Issues highlights all the necessary decisions that need to be made when the time is right and who can help you ensure your wishes are documented. Legal matters and spiritual and emotional well-being are all very important factors in this stage of your life and should be discussed with your health professionals and your family.
The Lung Foundation Australia has produced the Better Living with Your Chronic Lung Disease educational DVD series. This is one of 10 educational DVDs that will assist you to be able to live a better life with your chronic lung disease. To find out more information, to order resources, or to view one of the other 10 DVDs in this series, please contact the Lung Foundation Australia on 1800 654 301 or visit our website on www.lungfoundation.com.au. Thank you for watching Managing Your Lung Condition. The Lung Foundation Australia Chronic Lung Disease Self-Management Project is supported by funding from the Australian Government under the Chronic Disease Prevention and Service Improvement Fund.